Okay, so we're going to talk about L-spine, lumbar spine mobility. So as with every other joint we've covered, mobility is also going to encompass mobility in the joint above and below. So for the lumbar spine, that's going to be the T-spine above it, and then it's going to be the hip below. So a couple of these exercises will target the hip and the T-spine as well. But we're going to start with CARS for the lumbar spine. So CARS stands for controlled articular rotations. So if you've ever done a cat-cow, that's basically what we're going to do, but we're going to slow it down a little bit, and we're going to really try and isolate each vertebrae. So this is a really slow movement, and Andrea is going to start by dropping her pelvis forwards. Yeah, and then she's going to try and arch through each spine at a time, each vertebrae rather, until she gets to the top. Good, and then she's going to go back the other way. So really trying to isolate, it's quite tricky to isolate each vertebrae rather than them all moving at once. Good. So a lot of people have quite a bit of extension in the lumbar spine and limited extension in the T-spine, and then the opposite, they have a lot of flexion, which is this movement, in the T-spine, and not a lot of flexion in the L-spine. So it's really important to try and increase the range in each movement, especially flexion in the lumbar spine and extension in the T-spine. And then Andrea can come back to neutral, and we're going to do side bending now. So she's going to keep her rib cage, her thorax where it is, and she's going to tilt her pelvis to one side, imitating a side bend. And the same thing goes here. She's trying to go slow and controlled. Yeah, and move each vertebrae. Good. Really good. Awesome. So we're going to go on to something called the Mackenzie protocol. So this is especially important for people who are dealing with disc pathologies. Basically, we're taking the low back into extension so that we kind of push the disc back into place. So what Andrea is going to do is she's going to demonstrate the Mackenzie protocol here. So she's going to bend forward, and we're really trying to extend from the low back here. Do you want to maybe turn sideways? Sure.
Keeping the arms straight.
Mm-hmm. Okay, and you should feel it in the low back when you do that.
And 3 sets of 10.
Okay. Good. Next thing we're going to do is we're going to go into T-spine mobility. So we said earlier that the T-spine has limited extension for a lot of people, which means that the lower back compensates. So we're going to work on extension in the T-spine. So Andrea's going to start at the top of her rib cage, and she's going to work up to the base of her neck. She's going to cross her arms over. She can also support her neck here, and she's going to arch back, and she's going to breathe. That's one of the most important parts of this, because we're working through the rib cage, so if we're not breathing, things aren't going to relax and move. And so she's going to relax back. She can hang out on a spot until she either feels herself release over there, gain more extension, or the intensity decreases, and then she's going to roll a slight bit up her back and do another section. Good. Awesome. And you can also hang out if you find a spot is particularly sticky. You can hang out there for a little bit and breathe. Good. Okay, so we're gonna go over how to find pelvic neutral using an exercise ball. So Andrea is sitting on the exercise ball right now, and if you watched our posture video, we talked about how some people, like myself, are quite lordotic. So my pelvis tilts forward, whereas Andrea's the opposite. Hers actually tilts backwards. So we're going to go over how you can find that pelvic neutral to then use in all of the other exercises you're doing. So what Andrea's going to do is she's going to rock all the way forwards, like she's sticking her butt. Yeah. So pulling her bum under. That's her posterior rotation. Now she's going to go into an anterior rotation, which is sticking the bum out. Good. And now she's going to rock back and forth between those two extremes, and she's going to find a medium where she feels comfortable. Good. So this medium is a pretty flat back with a slight lordotic curve, very slight though. Good. And then she's just going to try and find that position. And then we progress from sitting to standing, where she does the same thing. Okay, and the next thing we're going to do are called windshield wipers. So on your back, This exercise is just for lumbar and, for lumbar and T-spine rotation. So Andrea's just going to allow her knees to fall to one side. Yep, good. She can breathe and hang out here and then go to the other side. And we're just gaining rotation in through the lumbar spine. Really good. Good. And then the next exercise is for hip mobility, which is, as we said at the beginning of the video, very important for lumbar mobility. So these are multiplane lunges. So we're going in 3 planes. Okay, so Andrea's going to take a lunge forward, good. So that's our first plane. And then the second plane is going to be out to the side, good. And then the third plane, good. And so these are just a really great exercise for warming up the hip, increasing hip mobility, which in turn has an effect up the chain to the lumbar spine. Really good. And you would kind of do 3 sets of 10, both sides.